First question we have for you is, did you originally want to become a pharmacist?
I did. I always enjoyed the science classes when I was in high school, and so in junior high as well. And so I always sort of had focused in on some sort of healthcare career. And so I guess one of my cousins mentioned that she was thinking about being a pharmacist. So when I started researching in more in depth, pharmacy seemed like the best choice for me. So really, when I was about 12 or 13, is when I decided I wanted to go to pharmacy school.
Oh, wow. Okay. So, which school did you go to? Where did you receive your pharmacy degree from? And would you do it again if you had the chance? Would you go back to there?
I went to West Virginia University.
Okay.
And at that time, that was the only option in the state of West Virginia.
Okay.
And I've been a pharmacist for 33 years, and I would do it again in a heartbeat. Yeah, it was probably one of the best decisions I've made. Yeah.
Okay. What are some of the aspects of it you might want to change on your career?
Well, for me, I've done I've worked in many different areas of pharmacy, but I sort of wish that I had done the lifelong learning. I feel like I should have done a better job in keeping up with things that were going on, the new drugs that came out.
Okay.
And because I sort of ended up in a specialty area, and in that area, I wasn't dealing with diabetes and hypertension and things like that, so I got a little bit behind, but luckily this job's helped me catch back up.
Okay. Oh, you said you got into a specialty, because the next question we're going to ask you was the specialty you selected in the pharmacy career?
Well, my specialty was home infusion, and I guess it just was a natural fit because when I graduated from pharmacy school, this was back in 1981, actually the pharmacy in the hospital did not make the IV preparations. They were made up on the floor. So in the early 80s was when accreditation bodies mandated that hospital pharmacies had to prepare the sterile products down in the main pharmacy. So they hired several people from my class to start the IV admixture program. So from 1981, I was hired to do IVs, and so then it just kind of developed into doing IVs and then going into home infusion and then owning my own.
Oh. And what influenced that aspect?
To go into home?
Yeah.
Well, I guess part of it was I always have felt comfortable with the sterile compounding, because I've always done it. So it made it really an easy fit, and I had small children at the time when they started home infusion, and it is the schedule was advantageous for child care.
Okay, yeah, that's always important, especially for
Just like as a supplemental question to that, if you could go back, would you choose to choose another specialty to go into? Would you still choose home infusion, or looking back, would you say there's anything else you wish you could have gone into more?
Well, I probably would still go back to home infusion because I really like the combination. It's a combination of, say, hospital and retail, because you do have interaction with patients and their families, and then but you do clinical aspects, like you have to monitor labs, you can write TPNs, you write antibiotics and make recommendations for the physician. So really, that's my favorite thing about it, because it kind of blends both. And to me, I think it's the perfect fit. I think I would still probably do home infusion.
So, how do you feel about residences, and how do you value the importance of the residency?
Well, when I went to pharmacy school, things are quite a bit different from when I went to pharmacy school. They didn't even have the PharmD. That was not available to me at the time, and then it came out like 20 years later. I think if you want to be a clinical pharmacist today, and even actually a hospital pharmacist, I believe now, it's probably important to try to do at least 1 year postgraduate. So I would recommend that if that's the way you want to go, to do that and do it right out of school, because once you're out and working, it's a lot harder to go back.
Okay. So besides working in the home infusion field and now academia, which other fields of pharmacy did you work in?
Well, as I said earlier, I started out as a hospital pharmacist, and in the hospital pharmacy, I did more than IVs. You know, we actually we were in the forefront of clinical pharmacy back in the 80s, and we had a pilot program where we did warfarin dosing, and also through my hospital, we supplied the drugs and the consultant pharmacist for a nursing home that was located near the hospital, so I was the head consultant pharmacist there. And then I've also done some retail, not a lot, but I've done retail as well.
Okay. So of all of those different fields, which one was the most challenging?
Well, I don't know if it was challenging like in a hard sense, but I felt like I was mentally challenged more in the hospital setting because you are there, the patients are there, you have the labs available to you, you see the oral medications and the therapy and the treatments as well as the IV medications, you see what kind of procedures are performed on the patients. So I feel like the hospital pharmacy kind of brings everything together, but it's missing the one-on-one component with the patient interaction, but it keeps you up on everything else.
All right, talk about a time when you interacted with a patient and what about that touched you the most?
Well, the thing that touched me the most was when I owned my own infusion pharmacy, and I had a patient that was an infant. He was probably when I was like a year old, and he had short gut syndrome, which means he didn't have enough intestines to allow proper absorption of his. He couldn't actually absorb enough calories to sustain him, much less to grow. So he had to be on total parenteral nutrition. So he got most of his nutrients intravenously, and those patients tend to have they're at risk for infections, and he had an infection, and he went to University of Pittsburgh's Children's Hospital, and they had ordered antibiotics for him, and they were coming home. They lived in the southern part of the state. The mother called, and she was just so worried because she didn't want him to miss a dose of his antibiotic, and so she called me, and so I went out to the pharmacy and prepared the doses so they could stop by, and I was there and helped her administer. Well, I helped her. She knew how to do it, but I stood there with her, and she gave the dose to the child. And, you know, it was so sad because she was in tears that I would want to come out there and do that. And I told her, I said, this is what I'm doing this for, is, you know, to help people like you and, you know, care for your patients and everything. So that's probably touched me more than anything.
So what advice do you have for us? We're still getting into the field, we're young, so what advice do you have for us, especially in challenging situations?
Well, I think the best thing you can do is work on your communication skills, do as much patient interaction as you can, because that's going to help you for the rest of your career, being able to talk with patients and different patients and strike up conversation, things like that. Also, like I said, keep up with the lifelong learning, so you don't come up later and feel like you're short up on some information. And then just always know where to go look up information, because my one little thing I say is the hold button is your friend, because no one is expected to know every single thing. I mean, everybody, there's just too much information. You cannot know everything. But there's a way that you can say, oh, well, just a minute, I'll look that up, I'll be right back, and put them on hold. Don't feel like you have to blurt out an answer if you're not sure. You can always use the hold button and then come back and answer appropriately.
Okay, thank you.
Just a question. You said you've been in pharmacy since before the PharmD. Just both in pharmacy school and pharmacy practice in general. What have you seen like the major changes, and what do you hope to change in the future? What will you hope change for the practice of pharmacy in the future?
Well, what I've seen, a big change is just when I was a pharmacist, if you called and challenged a physician, they were not very, they were, that would be like, that's what I ordered, that's what I want.
Yeah.
So I feel like, especially with the interprofessional activities that we're doing with the PAs and nursing, and we do some with the osteopathic school, I think that there's a better understanding with the other disciplines that where pharmacy has a place and that we have a certain skill set that they can use. Like I said before, no one can know everything, but you know, you have a special piece. They can't know everything either, so I feel like there's a lot better interaction between the disciplines. And I think just the patient care aspect, I mean, when I got out of pharmacy school, I'm sure you remember the pharmacists were up on this pedestal, you know, with this, you know, wall, and you could just barely look over and see the pharmacist. And now the pharmacist comes out, talks to the patient, and they're really becoming, you know, a great informational tool for patients, and then good for screenings. You know, we can be the front line to screen people for diabetes and blood pressure and things like that. Those are things I never thought would happen.
Our last question we have for you is, have you ever worked with a pharmacist who got into trouble with maybe drug abuse or prescription?
I've never worked with someone, but I know of someone.
Okay.
And generally it happens, especially for pharmacists, because they know. But this particular person that I can think of was in an accident, was put on pain medications, and then just had a really problem weaning off of the pain medications. And then I think that, you know, when you have a whole shelf full of of things, you know, when you're trying to work and you're in pain and you see that bottle there, I think that lady kind of stepped over the line. So, but hopefully that was many years ago. So hopefully now they have programs for pharmacists, impaired pharmacists, and the PRN program. And so I think that there's ways to help people who would feel that way, that maybe that won't happen as frequently, hopefully.
Any other questions?
Just one. You studied pharmacy before 1990, when the curriculum was different, a bit different from what it is today. And I think it was redesigned, the curriculum was redesigned after 1990 to face the challenges of the health system today. Are you having any obstacles with your kind of education as a pharmacist you had before 1990 and practicing today?
Well, definitely, because we were not taught like patient assessment skills. We weren't taught, you know, to interact as much as what you are. So as far as that goes, I was never taught that. I had 1 month of a clinical rotation, a med team where you did round with the physicians and everything. But for me, because I had that specialty pharmacy, it really didn't hurt me, but I just wish that I would have had more, like to fit in today, to be a pharmacist today, you have to have more communication skills, and you just need to like learn the things. Like I'd never taken a blood pressure until I came here. I had to learn it here. You know, I didn't do blood glucose or A1Cs or anything. So actually, for the first couple of years, I've been learning right along with the students, because that's not things that we were ever trained to do. And but I think it's great, because I think pharmacists can play a key role in, you know, the upfront screening, because we're the most accessible healthcare